Welcome to the Plant-Centered and Thriving Podcast. I'm your host, Ashley Kitchens. Welcome to the show, Plant-Centered listener. My name is Ashley. I'm your host today. And guess what? I have two guests with me today. And y'all, this is a very special episode because we nerd out over all things gut health. I'm talking IBS, SIBO, chronic constipation, supplements, not supplementing, treatment, no treatment, natural, prescriptions, those types of things. It was fascinating. I'm so excited for you to listen to it because I feel like no matter where you fall on the gut health spectrum of having like really great gut health and never having issues in your life to growing up with issues, we cover it all. We even talk about how gut health starts at a really, really young age, and Dahlia and James talk all about it, and it's so incredible. Okay, I don't want to give too much away, and I feel like I always say that, but before we get into it, I want to give a special shout out to our listeners. Y'all, we appreciate you so much, and today, especially if you're listening from Riverside, California, Athens, Georgia, or Brisbane, Queensland. Thank you so much for listening with us today. So, like I said, I have James and Dahlia on the show today. They are both registered dietitians, and they are the co-founders of the integrative dietetics practice called Married to Health, and the first 100% plant-based SIBO/IBS nutrition program. Y'all, these two are a gut health powerhouse, I'm telling you. As gut health dietitians, Dahlia and James's goal is to spread knowledge about the importance of incorporating plant foods to support a healthy gut microbiome, #goodgut, and help those with gut issues get back to a thriving gut microbiome. I think that was one of the just most positive takeaways from our interview today was that there is hope. Again, no matter where you fall on the spectrum. So I'm just thrilled for you to listen to this episode. If you're not driving, I would highly recommend getting a pen and paper so that you can take notes because, again, we cover so much information and we go pretty deep. I mean, we scratch the surface because there's a lot to talk about, but we get into it. So please join me in welcoming Dahlia and James to the show, and we're just going to jump right in and start chatting. Let's just start with, I guess, what you all do and how you became so passionate about gut health in particular. I'm kind of just curious about that.
I'll let ladies first.
I think that I became curious about gut health because I had to be. It was on my front door knocking. I myself, as long as I can remember, have had gut issues. I was that kid who remembers being chased by my mom with suppositories in her hand. And I remember, yes, right? Like constipation, bloat, stomach aches. These were a theme of my life. So it really wasn't until I realized, oh, not everyone feels this way. And this is taking away from my quality of life. That even before I dreamt of becoming an RD, I began thinking, I think something's wrong, but I don't really know what to do about it. And then I think as I became more educated, I started my nutrition degree, I became an RD, and kept feeling like every position I landed was wonderful, but just not where I belonged. I was like, there's something deeper. I started in the community, and then I went to pediatrics because I was like, maybe if I start from the beginning, that's where I'm supposed to start. And then I learned more about like functional and integrative nutrition. And I was like, this is still not it. This is getting close, but it's not it. And then I found the gut, and I was like, this is it for me.
Wow,
and I think for so many other people.
And that's what we'll go as far to say, really, for us, from, and again, this is from us, but I think it's backed by a lot of research, and what we found is really gut health is the nexus of all health on the planet, more specifically human gut health. And I say that, and then we have another statement that we say is really the inner ecosystem, meaning your gut microbiome, is the most important ecosystem on this planet because it is connected to humans, right? It's not cows or owls or geckos that are rounding up animals into CAFOs and operating these huge, concentrating feeding lots and things like that. It's humans. So if humans understand, hey, what's best for the smallest creatures on this planet, which are our microbes, archaea, fungi, bacteria, protozoa, even viruses, which aren't really alive technically, But these are all encompassing in this ecosystem. If we do everything possible that's good for this ecosystem, it will have massive ripple effects. So that whole journey Dahlia's talking about with our even our own health struggles, and then working 9 to 5s and being like, we don't quite fit in, and just kind of going on these stepping stones has led us to the gut. And really it's like this, this is it, right? Like this is the nexus, and this is the most important ecosystem. And we really, really want people to get that message and go, if you care about the Amazon, or even if you're trying to like just get a 6-pack, or whatever your goal is, like I just want to go plant-based, care about this inner ecosystem, and it will have massive ripple effects. Yeah.
How can, like, and that's a great question. Like, how can we start caring about our ecosystem? Because I'm sure, similar to Dahlia's story, like there are a lot of other people out there who had this same experience where they had chronic constipation as a kid, or maybe into adulthood, and they're like, maybe they still have it, and they're like, what is going on? So how do we maybe just start paying attention a little bit more to cultivating a healthier overall gut?
I think that our bodies are so incredibly intelligent, and they're always communicating with us. I don't think it's a coincidence that we have these phrases like, I have a gut feeling, go with your gut. Our guts can tell us so much, and that could be so informational regarding many aspects in our life, what we're eating and how that's communicating to our microbes and our bodies. It could also be who we're sharing energy with. It could be how we're moving our bodies, or a lack of moving our bodies. It could come down to things that are surrounding our gut, right? Things we're putting in, on, and around our bodies that our gut can then communicate back to us and say, hey, I didn't really love that. That didn't really make me feel my best. I'm not really thriving. I think people don't really realize that we have over 100 trillion microbes in our gut microbiome alone, and we are far outnumbered human DNA cells to microbial cells, or microbial DNA rather. And so they're often so much more in tune, because there's so many more of them. They're so much more in tune with things that we sometimes don't realize yet, we have not yet perceived. So when the symptoms are knocking at our door, if we are somebody like me who has lived with symptoms or had lived with symptoms for such a long time, it's really tuning into them and saying, what is my body trying to communicate to me? And if you're not someone who's ever had symptoms, it's tuning in and saying, what is my body loving, and what's really working for my gut? And I'm so grateful I don't have gut issues. How can I continue to ensure that I don't?
And I just want to add, being here on this podcast, if you're watching this or plugged into a more plant-based community, you're on the right track. Like that can also be a first step, right? Like it's really just kind of taking these steps at your own pace, but understanding like, hey, okay, I need to kind of listen and maybe slow down a little bit. That's very powerful. It's not always something you have to do. It's maybe things that you don't have to do, right? Like I don't have to be scrolling for hours on my phone, absorbing all this info and feeling overwhelmed. I don't have to like go buy the newest detox kit, and I don't have to constantly be going places nonstop. It's like, give yourself some rest to even just listen to your symptoms and listen to your body, and take a nap, or or chill and watch or listen to a podcast, and then go, okay, and then see what resonates with you, and just take it step by step. It could be micro steps, it could be huge leaps, like it's your pace. But the very first thing is almost like not doing and just listening, and that way you can even get those gut feelings and ultimately realize, like, if you are having symptoms, that's a blessing. Like we always say, symptoms are blessings. Like they are going to help you understand your body. They're there for a reason. If we didn't have symptoms and we just like keeled over and died in our 30s, 40s, or 50s, like that's not good. You want to have symptoms, and hopefully you do something about it. I think where we're running into problems is that we created this whole industry and a lot of drugs that can mask symptoms. So we kind of continue going through life with the symptoms while trying to like fight it, rather than just saying, hey, what are you trying to tell me? Let me not fight you anymore. Let me just listen to you and actually grow deeper into the root. And that's really what we're called to do, and that's why we're called integrative dietitians. We're like not just saying what's on the surface, gas, bloating, I get headaches, I have, eczema or hives and all that. Okay, here's a cream and here's a diet plan to help to help with those surface things. It's like, no, let's go deeper. Why is this happening? What has your body been trying to tell you? Where did this come from? And we go deep to that root, essentially. Yeah.
Yeah. I think I have never heard someone say it's a blessing to have symptoms. And we talk about positivity a lot and trying to look at like the silver lining of things, but I've never looked at my chronic constipation for 20 plus years as a blessing, but I wouldn't be plant-based and have this business if I wasn't chronically constipated. So
Exactly.
I think that's wonderful. And to touch on your point too, I think, yeah, you're right. We can go the rest of our lives maybe taking medications or things like that, masking our symptoms without getting to the root cause. So I think, again, that's just a great thing to reiterate. And I'm curious, you touched on this a little bit. What would you tell someone who maybe is trying to go plant-based? Because we know that that's really helpful for our gut, but they're like, James, Dahlia, I can't tolerate beans, or I'm just extra gassy. Like, how do you kind of help people maybe transition to a plant-based diet? Or maybe if someone is on a plant-based diet and they're still really struggling with some of those GI issues, obviously it can be a numerous, number of things, but yeah, how do you typically approach that?
I think a phrase that I like to always reassure my patients with is today's symptoms are not just about today's meals or yesterday's meals. Often there's a story behind them. And so one thing I always start every single new patient with is tell me your gut health story. I want to hear it all. And we do really collectively need to understand together how this story is coming together and creating these symptoms that you are experiencing. Because we do know, yes, certain foods might be a little bit more involved in digesting. Certain foods might be a little bit more fermentable. Certain foods might be a little bit more complex. But we're very complex. So, if there weren't things that came along in our story that affected our complexity and ability to digest certain foods, there's so many people walking around there who don't have excessive malodorous gas anytime they eat beans, or who aren't doubled over in pain when they're having onions and garlic or a piece of watermelon. So where in your story did things start to change? And that is such an important piece. It's very thorough as well. In fact, even for those who aren't going to work with us, we think this is so important for people. So we're publishing this on our website for people to obtain themselves, writing down their story from really day one. And we know research shows day one starts in utero with mom. Wow. Studies show the first 1,000 days of life can be some of the absolute most impactful to not only our gut microbiome, because that is what reflects in the data. We show that it also is involved in the building of our immune system and the building of our brain. But so importantly to us, the gut microbiome. So I usually will start there with my patients. I always say, take me back as far as you can remember, or as far as your mom can remember. How was her gut health during her pregnancy with you? Because if mom had IBS, there's new data that shows that actually can pass on some microbes to baby. They used to think that the uterus and the placenta, that was a very sterile place for baby to be. And we know that's not the case. They thought prior, it's only when the water breaks and the baby passes through the mom's vaginal birth canal, or is delivered by C-section, that's the only time baby is exposed to microbes. That's their first exposure. That's not true. We do know that the amniotic sac, that is permeable. So mom's microbiome as well can permeate. Mom's gut bugs can make their way through and really speak to baby's gut bugs and really start speaking to baby's immune system. So I want to know, how is your mom's gut health when she was pregnant? Were you breastfed, or were you formula fed? Were you a vaginal delivery, or were you a C-section? What was your exposure to microbes and immunoglobulins from the beginning? Were you colicky as a baby? Because now we're actually attributing colic to GI inflammation in infants. So did you have colic? Was there something there from day one, day zero? And then take me from there. What was your antibiotic use like as a kid? Did you have an anxious personality? Do you remember having stomach aches and bloat and constipation like I did as a kid? What did your diet look like in those first 1,000 days of life up until you're about 2 years old? And then let's keep going from there. Tell me about your teens. I want to hear about your menstrual cycle and your hormones, because that can affect your gut. In college, were you binge drinking, and were you eating on campus and not really having vegetables? These all can play such important roles. And I think people often I see it when I'm speaking to them. They're triggered by the most insignificant things of, oh my gosh, it's that one time I had to get my wisdom teeth removed. I was prescribed this really heavy dose of antibiotics so they could prevent infection. And that's where my gut issue started. It was this one trip that I took and I got food poisoning and my gut has never been the same. I did have colic as a baby and I've been constipated, and these issues have been with me for 4 decades. So really helping people travel back in time gives us so much information about presently what they're experiencing and how their gut microbes and their body is interacting with these foods that they're intending to try to eat, digest, and absorb.
And then I know that's a lot to summarize. I mean, I would say anyone that plans to have a child at some point, realize, especially for women, your gut microbiome is the most special, most significant inheritance you will give to your child. So you are literally passing that on. So again, that's why we call it the nexus, right? It's literally the gift that keeps giving. And science is showing us we are losing diversity in this ecosystem, right? Just like we hear that about other ecosystems, coral reefs and rainforests, we're losing it in our human microbiome. So, and for all the reasons Dahlia just said, compounded by decades and decades and decades of this industrialized system that we're building that is decreasing. So it's like, right, it's cause and effect, right? So we're going, wow, the exact society we're creating is detrimental to our most important ecosystem. Wake up call. Like, whoa, wait a minute, slam the brakes, right?
And it can, hearing that sounds scary. And I don't ever want listeners to feel like, well, I'm doomed. I inherited a poor gut health. So, this is my lot in life and I can't change it. So let me just not care about what I'm eating. We know that every single meal can shift your microbiome for the better or for the more inflammatory. So you can go anti-inflammatory, more inflammatory. And that's where we really created this concept of heal with each meal. And then with that is feel with each meal, because we know it goes beyond what's just on your plate. It's what's in your mind. It's who's around you. That all impacts how well your gut can heal. Our bodies are so amazing. Our microbes are so amazing. We quite literally could cellularly be a different person in 3 months than we are today. So there's so much hope that whatever you inherited, whatever happened along your health story, you can take steps to really shift that.
Yeah. Well, I like that. I like that you go back as far as conception almost, because I think that's so helpful. Because like you're saying, it's so hard to look past that one time I had food poisoning or the one time I had this huge bout of antibiotics and thinking like that was the cause, when it could have started, like you said, while you were in your mom's womb. And I just think that's pretty fascinating to kind of unpack, especially with your clients, I'm sure.
Or it's like, or we hear this all the time. It's because I went vegan or plant-based. Like, that's what did it. Dang, I started eating chickpeas and broccoli and it just messed me up. And we hear this all the time. It's like, well, what about like the 20, 30, 40 years before that? Like, really, that doesn't matter. It's like, of course it does. So
yes. Yeah. So we've touched on IBS a little bit in talking about this, but for someone who comes to you with a diagnosis of IBS or they've just been struggling with it, how do you get at the root cause? Because does IBS really tell us what's going on?
So IBS is kind of they call it a diagnosis of exclusion. So it's kind of, if you can't include another diagnosis, but somebody is experiencing a consistent change in bowel habits and in pain or gas and bloat, then they will kind of give this exclusionary diagnosis of IBS. We can't diagnose you with inflammatory bowel disease. It's not ulcerative colitis. It's not a colon polyp. We don't know what it is. It's IBS. Your bowels are irritable. And, that puts someone on the track of trying to say, okay, how can I make my bowels less irritable? But we do know, especially in the last 5 to 10 years, there's been so much more research in the gut. And I'm so, so, so grateful and excited about this, because recently there were studies that even showed 14 up to 70% of IBS cases are actually something called SIBO, small intestinal bacterial overgrowth. It's a dysbiosis in which there's an overabundance, there's an overgrowth, there's an overpopulation of inflammatory and or anti-inflammatory, perfectly healthy gut bugs, gut microbes that make their way into a place they don't belong. They make their way into the small intestine. And that's what can cause a lot of gas, bloating, abdominal cramping, that hypersensitivity that people feel where even though they don't look distended at all. They feel super bloated and in pain. So we're now starting to really differentiate. Okay, we have this umbrella catch-all under IBS. What are the actual causes of this irritable bowel syndrome? Who are these players in the game? Who are these microbes that we can attribute some of these gases and some of these different symptoms to? So we're in a really exciting time where people aren't going to just walk around and say, I have IBS and I just need to not eat things that I really enjoy and, be
next to a restroom.
Yeah, constantly know where the restroom
You'll
is.
have to live that way.
I'm going to work with my knowledgeable care team and we're going to figure out why I have these symptoms of IBS and what exactly is causing it, whether it's SIBO, whether it's as a result of having some type of inflammatory bowel disease or something else. I'm going to figure out why I've been given this diagnosis of IBS.
I feel like I've actually been hearing more and more people being diagnosed with SIBO. So let me ask you all first, how is SIBO diagnosed for someone who thinks maybe, I've had IBS for a long time, maybe this is what what y'all are talking about, but how is it diagnosed?
So there's a few ways to diagnose SIBO. The gold standard best way, if you want a definitive diagnosis, it would be during an endoscopy, which is when a gastroenterologist puts a camera down looking in the esophagus, the stomach, and the small intestine, and they'll go into the small intestine and get a little bit of fluid from it, a small bowel aspirate, and then they'll send that off to pathology. They'll test that and see is there elevated hydrogen, methane, or hydrogen sulfide gas that's present. Some gastros will even test, is there elevated fungal spores? Does somebody have SIFO, fungal overgrowth? Gold standard way. We do know that is invasive, that if somebody is not yet 45 and has risk factors, they don't qualify for a colonoscopy. So it could be quite expensive or an endoscopy, sorry. They don't necessarily qualify because they don't have symptoms for it. So if somebody doesn't qualify for one, it's not very attainable and it's not very affordable and it's invasive. So secondarily, most commonly, people are going to have a breath test where they could either go into their gastroenterologist's office, and often they'll have a breathalyzer machine there that will analyze their breath right there on site, or they could receive a kit from their gastroenterologist or their specially trained dietitian, and it's an at-home kit where they receive bags or tubes to blow their breath in, plus a little packet of either glucose. Some providers will prescribe lactulose, which is glucose plus lactose, and somebody drinks this fermentable substrate, this fermentable carbohydrate, and then they see, okay, I'm blowing in my bags or my tubes every 15 to 20 minutes. How much gas am I expelling and what type of gas? Is it hydrogen gas that's made by certain bacteria? Is it methane gas that's made by certain archaea? Is it hydrogen sulfide gas that's made by other types of bacteria? I sometimes have people tell me, my naturopath or my functional medicine doctor, my nutritionist, they diagnosed me with SIBO on a stool test. Again, SIBO is small intestinal bacterial overgrowth. Stool tests look at the large intestine, the colon. So although that can tell you maybe you have an overabundance of a certain type of microbe, stool tests can never diagnose SIBO. So if somebody out there is listening and they're like, oh, I was told I have SIBO because I did the stool test, that is not an appropriate way to diagnose
Another
SIBO.
popular is organic acid testing too. That as well, like an oat test is what we'll call it too. So typically a breath test is, if you're not getting a small bowel aspirate, a breath test, you don't really want to just go off an oat test or a stool test, especially if you're not looking at symptoms. That's another thing we see is sometimes they'll go to a naturopath, a patient will come in and be like, yeah, I have SIBO for sure. Okay, and come to find out, it's like they weren't really having symptoms, but the naturopath diagnosed it on the stool test. And it's like, well,
or the urine test.
Or urine test. And it's like, well, wait a minute, you're not having the symptoms. You haven't done a breath test. You've just done a stool test. And now they're on like a low FODMAP diet. They're doing all these things. Or even worse, they've taken antibiotics or antimicrobials. So that can also be like, whoa, wait a minute, let's put on the brakes, because you're treating for something you're not actually fully diagnosed with or even fully feeling the symptoms of. So don't just also go off testing or a piece of paper. And even backing up to nerd out a little bit, like, and realizing like there's so much cool stuff going on inside of you, right? Like there's this whole
Yes.
universe going on inside of you, and these microbes in the large intestine in the right place are making all these beautiful gases. This is a byproduct of all the great work they're doing, right? We hear about probiotics. These are the probiotics doing the work and making the gas, which some of which can be postbiotics and beneficial. And we always say like farts are friends. Like this is where your farts come from, right? And in a healthy person, you're making gas, you're gonna pass some gas. Now, if it's excessive or if it's foul smelling, like Dahlia mentioned, like if your farts are smelling like a rotten egg that's been there for a couple of weeks, that is something you want to look into, right? That's telling you your population is off. There's something going on, especially if it's happening very chronically and frequently. So, but overall, passing gas, being a little gassy after a meal and passing it and feeling good and having bowel movements, that's all saying, hey, my microbes are putting in the work and keeping me healthy, right? So just important context there.
Good. Well, my dog must be incredibly healthy, so that's good to know.
Your dog.
No, just kidding. Yeah. No. So, okay, I'm curious because y'all mentioned the low FODMAP diet and being the experts you are in gut health. What's kind of your opinion for low FODMAP, maybe in relation to SIBO in particular?
Yeah, so I will say the low FODMAP diet is probably the most widely prescribed diet for SIBO, for IBS as well. It is a diet that stands for low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. What does that mean? They're carbohydrates. So there's specific carbohydrates that are poorly digested and absorbed in the small intestine for good reason. They're not meant to be digested and absorbed in the small intestine. They are meant to pass on to the large intestine and be fermented by the large amount of microbes, including bacteria, that live there. So these gut bugs, they thrive off of FODMAPs. They're their preferred fuel source. These FODMAPs allow them to eat, because again, if all of our food and every single thing that we eat is getting digested and absorbed in our small intestine, the 10 times more plus of bacteria and other microbes that live in the large intestine will starve and die. We'll all be constipated and we'll all be in pain. So FODMAPs are great. We want them to pass through the small intestine undigested, unabsorbed, unfermented, so they can go into the large intestine, into the colon, and all those amazing gut bugs can start eating them, fermenting them, maybe making a little bit of non-excessive gas from them, and then giving you a gift back for saying, ooh, these are prebiotic, these are gifts for me, they're prebiotic fiber, prebiotic carbohydrates. The probiotic bacteria, I'm going to take them, gobble them up, and then I'm going to give you these postbiotics. And some of those are things like short chain fatty acids, and these can be things like butyrate, acetate, propionate, but they basically do things like heal the lining of your intestines. Who doesn't need that? We all need that. They can lower your cholesterol. They can lower your blood sugar. They can support your pancreas in producing insulin. They can support cardiovascular health. They can support body composition.
They're anti-cancer,
Yes.
antifungal, like
They do so many things.
insane.
So I think because the low FODMAP diet has become more widespread, people are afraid of FODMAPs, not quite understanding them. So if you are somebody who has great digestion, you don't have dysmotility, meaning that the movement in your gut is off. You don't have dysbiosis, meaning the balance of your gut is off. You don't have permeability, meaning the structure of your gut is off and leaky. Eat FODMAPs. Please eat a lot of FODMAPs because they're great for you. They're great for your good gut bugs, and they'll do great things with them. If you are somebody who has one of those things that I mentioned, and you probably have been diagnosed with IBS or maybe even SIBO, then a temporary elimination and reintroduction of FODMAPs can be beneficial. The traditional way that Monash University in Australia came up with the low FODMAP concept is they proposed to say be in the pure elimination for up to 6 weeks. And so in that time, somebody's avoiding all those different groups of FODMAPs like lactose, fructose, fructooligosaccharides, galactoligosaccharides, different types of foods, mannitol, polyols. They're eliminating those for up to 6 weeks. Up to 6 weeks, no more than 6 weeks. And then you want to start the reintroduction phase. That's part 2 of the low FODMAP diet. You start group by group, one food at a time, introducing. So you can say, okay, I know it's not polyols because I was able to reintroduce snow peas and mushrooms, and I was able to introduce some of these other polyols, and I was fine with them. I ate blackberries, no problem. No gas, no bloat, no pain. let me move on. Let me get some fructose in next. Let me get in some of these fruits and some of these vegetables that have fructose. No problem. I'm good there. Oh, I got to galacto-oligosaccharides and I'm struggling a little bit. Or maybe I'm to fructans and I'm struggling with wheat. I'm struggling with things like onions and garlic and some of the cruciferous vegetables that are in the fructan group. So that's the goal of low FODMAP, is to say, let me give my gut a break, a reset. Let me, in that time, hopefully work on finding the root of why they were bothering me in the first place. Let me slowly start to reintroduce them as I'm working on my root, and let me assess my tolerance. And hopefully at the end of it, I'm coming out with knowledge that maybe I was able to successfully reintroduce all of them. Maybe I came out and said, there's still about 10 that I need to work on. I have these 10 foods, these 5 foods that still give me symptoms. And let me continue working to figure out why. So I think it could be a great tool. I also think that studies show that really only 50 to 80% of people respond to low FODMAP, which is great. That sounds like a good number, right? 50 to 80%. It sounds like a good number unless you're one of the 20 to 50% of people it doesn't work for. So we know it's a good start. And, it can be a good option, especially if you're not only told, go low FODMAP, but you're also given a referral to work with a dietitian who can guide you through it so you don't stay there. But then hopefully if it doesn't work for you, you're able to branch out from there and say, it's not the FODMAPs. What else could it be that's causing this digestive discomfort? Because there's something here, and food is a mirror, and it really holds up a mirror to me to reveal these symptoms. What aspect of food is it? Is it histamines? Is it possibly sulfur? Is it possibly something like oxalates, which sometimes very, very small percentage of people struggle with? Is it phytates? What can I really zero in on so that I'm coming out with healing and understanding?
So going back to that listening piece that you're talking about, as you're kind of going through this trial and error of figuring out, okay, what's working, what's not, but also really trying to pay attention to what's giving me that discomfort, or what symptoms are persisting and what could that be attributed to, which I'm sure takes time. So I should probably back up too, because I don't know if we explained how people maybe even come to get SIBO. Is there anything kind of more general, why people end up having SIBO in the first place?
Yes.
Yeah, maybe I'll start because I know it's a lot. I'll let Dahlia really kind of get into it in a quick, deep way. But a quick analogy on this is we give a debt analogy, and really, like we said, you're maybe 20, you're maybe 30, you're maybe 40, and what's been happening leading up in those decades, right? And we can think of it like debt. Imagine, and this is not hard to imagine in your teens and 20s, especially with college debt and loans. But it's like you've been maxing out your credit cards, you've been taking out loans, you've been accruing this debt. And what we're seeing in society is you can go one of two ways. You can go the carnivore keto way and go, you know what? Let's just, all those mail, the letters you're getting about your debt and the emails and phone calls, change your number, rip up all the mail, and just change your email. And there you go. We solved your debt. Just escape. And so what we're seeing is people going, just don't eat fiber, don't eat or eat very little carbohydrates, and just eat a bunch of chicken and steak and butter and all that, and you're gonna feel great. And there's people that go, wow, I do feel great because you've gotten rid of the phone calls and you ripped up all the letters.
I'm debt free.
You're debt free, right? It's like, no, the debt is still there. You're just not experiencing it or seeing it right now. But then when you get in your 30s and 40s, you go and buy a new car, or you need to buy a house now, or you need to send your kids to college, and your credit score is horrible, right? You realize, oh no, the debt's been here. And not only that, it's been getting worse the entire time, right? So what we're saying is, okay, there's that path. There's also the path of going, let's look at all your debt. Let's come up with a healthy budget, which is boring and it can be painful and it's hard work, and go, not only are we going to get you back into financial freedom and health, we're going to pay off all this debt. That is essentially a plant-based approach, right, to SIBO specifically. Now, how do you get in that
Why
debt? Why did you accrue this debt?
Need to think of that. So, there's a lot of risk factors, but so many things that can play into dysmotility or affecting the rate of motility. We know things like hypothyroidism. If somebody's thyroid is functioning at a slow rate, their metabolism and their metabolic rate will be slow. And we have so many microbes in our colon. when they get hungry, they get hangry and they're impatient and they're like, hey man, I know if I just open up this little door between the small and large intestine, this ileocecal valve, there's food on the other side and I'm going to get it. So if you're somebody who's had a traumatic brain injury maybe, or you have neurodegenerative disease and that affects how those nerves and muscles are working together also in your digestive tract, those gut bugs are like, hey man, I'm going to go up there. Maybe it's somebody with something like dysautonomia, Ehlers-Danlos syndrome. We do know somebody with dysfunction of their autonomic nervous system will struggle to regulate the doors. So the doors might just spontaneously open up and then all those gut microbes are like, hey, party, the club doors opened up and I'm going in. So things that affect motility are so important. For women, hormones and pelvic floor dysfunction. Oh my goodness. I have so many patients who come to me and they're like, I don't get it. 2 weeks out of the month, I'm fine. And then 2 weeks, I'm a disaster. And I'm like, that's your hormones. So our hormones can also affect our motility and how we're digesting and tolerating foods. Our pelvic floor. I think there was a statistic that I read that 50% of women who have a pregnancy, not just a vaginal delivery, even a C-section, will leave that with pelvic floor dysfunction. Wow. So we do know those muscles, that pelvic floor, that little bowl of muscles at the bottom of the pelvic floor that hold up your bladder, your colon, your rectum, and your reproductive organs, their strength and integrity matters to how your digestion can flow. So is something affecting your motility? Did you get into a car accident once and have a significant neck injury, and maybe you're just saying like, oh yeah, I just have neck pain? That could affect your motility. Wow. So is anything affecting the rate of movement in your gut? And then is there anything that's affecting your balance in your gut, how well regulated and compartmentalized your gut microbes are? That could start top down. Diseases like certain autoimmune diseases like scleroderma that will affect how much saliva somebody is producing. That will affect your digestion. We do know we have things like salivary amylase that will break down carbohydrates. And if you're not doing that well enough just in your mouth, then that's going to affect your digestion. Maybe you have dental issues and you can't chew properly. That also is a risk factor. Do you not produce enough stomach acid because you have H. pylori? You have an autoimmune condition that's affected your proton pumps. Hypothyroidism again. Do you have gallbladder or liver dysfunction? Because that helps to regulate your microbiome balance and your digestion as well. So do you have dysbiosis? Did you take a bunch of antibiotics, steroids? Are you super stressed? That can give you dysbiosis. Do you take a bunch of non-steroidal anti-inflammatory drugs? Because that can affect the integrity of your GI organs. So many risk factors are here. So again, it's not just that food that you ate that one day. It could be so involved.
And for everyone, did you write all that down? Did you get,
yeah, right.
So it's a lot, but just to kind of synthesize that, there's 3 factors: chemical, physical, emotional. Everything Dahlia mentioned, all of those will go into one of these or mix and match with these 3 buckets. And that's where we, and Dahlia especially, has done a really great job of just being integrative in a sense of, do you need a pelvic floor therapist? Do you need an actual therapist? Do you need emotional release, which one of our dietitians specialize in? And understanding that there's so many triggers for so many things going on. And this is why we say it is really focusing in on that inner ecosystem and going, am I caring for this inner ecosystem? Or am I just kind of letting it all go and just flying by night and not really caring what I'm putting in, on, and around my body? You're then accruing that debt, right? It's just like someone going, I don't care if I buy this and buy that and go on this trip and go on that trip. Like you're not being mindful, right? And that will have an effect in the future, if not the near future. And that's where everyone's a little bit different. Some people don't care about their debt until they're 60 or 70, but it's still gonna be like a little bit of a gut punch, right? Some people feel it a little bit earlier, where we're seeing it more in like teens and in their 20s. And that's great, because then you can do something a lot quicker, and you're a lot younger, where you can get out of it a lot quicker too. So everyone's kind of different on the spectrum for sure.
Yeah, that makes sense. Yeah, I'm just curious kind of what your protocol is, because it sounds like people with SIBO, there's obviously a lot of reasons they may have it, and there are a lot of different treatment options and even diagnoses, it sounds like, now out there. What's sort of your standard, maybe general approach to treating a client who has SIBO?
Yeah, so standard approach, understanding where it came from, nailing down what type of SIBO one has, hydrogen, methane, hydrogen sulfide, and then understanding, can we work on one of those main three factors, the flow, the balance, and the structure of the gut? Will that kind of take away the SIBO? If you barely had a pinch of methane SIBO, and that's more attributed to constipation, can we get your bowels flowing a little bit better? And then that kind of alleviates it for you. So sometimes that is the case. If somebody's like, yeah, I started eating more plants, and I started using a little bit of magnesium, and then I started having regular bowel movements, I no longer have the SIBO symptoms. I think that it made its way out of my small intestine. Awesome, great. That was an easy fix. Again, if there's a root cause for it, if you have hypothyroidism, work with your care team to work on your thyroid. So if you need support for one of those underlying diagnoses, work on that. If it's usually a high degree of gas that's being produced, lifestyle and diet can certainly help to balance symptoms. However, if it's a large amount, it usually does need intervention and treatment. So usually you do need to eradicate the gut bugs, the microbes that made their way into the small intestine, and then really try to make sure they don't come back there. So that could either be with antibiotics, and the most commonly prescribed antibiotics for SIBO are ones that are not absorbed. So they pass through without changing really the plane of the entire body. So they're not necessarily a tip to toe, hugely broad spectrum antibiotic. They're very targeted. They usually go after E. coli, maybe Klebsiella, and a few other gut bugs. And they're really mostly active in the small intestine. So they're not going to affect somebody like Cipro or amoxicillin or one of these more broad spectrum antibiotics is. So somebody could elect to utilize antibiotics, which could include that one, rifaximin, Xifaxan, or a couple others that are used. There are also herbal antimicrobials, and these can be helpful as well. I know a lot of people think natural is always better. And I used to be one of those people, and now that I know better, I know that that's not always the case, because I do see that people use these herbs, which can be very helpful used in the right way, over and over and over, and they are more broad spectrum. So if somebody's living on herbal antimicrobials, they actually could be removing some of their healthy gut bugs from the other places as well.
And we see sometimes people don't realize they're on herbal antimicrobials.
Yes.
They just think, this is an herb, and this is a concentrate, and this is an essential oil. And
I didn't know grapefruit seed extract, or I didn't know that oil of oregano wasn't fine for me to take every day.
Right. So it's very important to know what you're taking and have that guidance and have it be strategic, because then you start to get skin issues, and then you start to get vaginal issues, and it goes from there. So yeah.
Yeah, but you do. If you need to eradicate, you want to eradicate. And then I always like to make sure that people are on some type of motility agent for a couple months following, so that way they can make sure their bowels are continuing to move. So things based in ginger or peppermint or other carminative herbs. And then making sure that we repopulate and restructure. So if the treatment plan did eradicate some of their healthy gut bugs, we want to refeed and reseed. And we also want to work on the structure. And so we use things like prebiotic fiber. Sometimes, in certain instances, I will recommend probiotics, certain specific, very conscious strains, or we'll recommend other anti-inflammatories. Sometimes I'll recommend gut nurture. So we did create gut nurture with Complement, who a lot of you might be familiar with. They might create your favorite multivitamin that you've been using. Yeah. But we're so grateful to work with Complement, and I wanted to create something that somebody who has SIBO actively is suspicious they have SIBO IBS, just got treated, they're feeling better with their IBS and or SIBO, that they could use. So we made sure we put all these components in gut nurture of a prebiotic fiber that comes from guar beans. It's called partially hydrolyzed guar gum. There's ginger in here that helps with motility, antioxidants. So we wanted to be really mindful of the people we're working with and saying, what has helped me, somebody who also had and has had IBS throughout my life, and now I'm on the other side of it for the most part. What can help others who are kind of going through this walk and in current treatment or post-treatment.
And then just to add to that really quick, and Dahlia has created and I have created, that's why we created this practice, which is a structure of support. Like whether it's Dahlia has a good gut membership where she communicates with her patients in between visits. We do have like a group with that. That's where we go live and answer questions. Like, you need the support because, as you can see, I mean, we're in this time and we're barely scratching the surface, and you've heard maybe a overwhelming amount of information, and on top of that,
Hopefully not.
each individual is, but look, depending where you are, some of you are like, oh yeah, I've heard this, oh, and I learned little tidbits, and oh great, I love it. Some of you like are completely new to this, and you're like, wait, SIBO is what again? So you know, in that spectrum, and we get that, we hear that from our patients and our community. So that's where, yeah, we really are just trying to create this safety net, this structure to empower you and to guide you and to really, really get you through a lot of these hurdles that you're coming across. But again, I go back to that debt analogy. It's not going to be this hard forever. Once you create that budget, you can maintain it and last with it, and it could be sustainable for the rest of your life. We don't ever, and this is for any of our dietitians who have other specialties as well. We're not here to just be like, okay, you're going to be stuck with us forever. We're going to have you be taking all this stuff forever, and you're going to be on antimicrobials forever and low FODMAP forever, or whatever it is. And no, it's we want to empower you to then be sustainable for the rest of your life, whatever that looks like. So yeah, with all
Wow.
that.
Yeah. Well, amen to that. I think that's wonderful. I feel like every good
Yes.
dietitian knows that the clients they work with, it's not for forever. It's a short period of time, because hopefully you can get them to a place where they don't need to rely on you maybe for information or treatment. Dahlia, could you mind repeating when you typically recommend your gut nurture supplement for people?
Yeah, definitely. So I usually will recommend Gut Nurture that we created with Complement. I usually will recommend this for somebody who's experiencing GI issues and maybe hasn't worked with their care team to identify what they are, but is looking for a little bit of help and relief. I recommend this for somebody who is currently undergoing treatment. It is completely low FODMAP, and so even if somebody is on a low FODMAP diet, a low histamine diet, a specialty diet, they could still use Gut Nurture. And this is also for the person who says, I went through treatment and maybe I did eradicate who I didn't want, and I'm working on rebuilding who I do want here, or I'm someone who doesn't have gut issues like James. And I just want to keep my gut well and nourish who I have and appreciate them and love on them. And so that's who Gut Nurture is for as well. I will say the only person Gut Nurture is not for is pregnant women, just because it has a little bit of licorice root in it. So we don't want to mess with early labor. We don't want to mess with, inducing any hypertension during pregnancy. So that's probably the only person that I would say Gut Nurture is not for during their pregnancy, but it's safe for lactation. It's safe for children. Our daughter loves it and drinks it too.
And especially, this comes with us every time we travel. Like, travel can be very stressful, overwhelming. You're
Constipating.
around
Yes.
a variety of microbes. We know our environment shapes our gut microbiome. Constipating. I'll be vulnerable and say I do sometimes miss my bowel movement when traveling with all the different time zones. So this is with us every time we travel. So that's really when I really appreciate it and love it a lot. So yeah.
That's good to know. I'm actually traveling quite a bit over the next couple of months, so I feel like I need to get myself some, because constipation, I feel like it doesn't matter what you do, traveling just always, I don't know, it just emphasizes it. So, yeah.
There's
Well, good.
reasons
Well,
for that.
first, so where can people find Gut Nurture? And we are big fans of Complement over here. So, is that the best place, or what would you recommend?
Yeah, I mean, if you go, I mean, you can go through our site, marriedhealth.com, and it's there on our shop page with
Actually, if
Complement.
you have, yeah.
You can
I'm sure you
go,
would
yeah,
have
if you
people.
have a link through Complement, but it's lovecomplement.com, and you'll find Gut Nurture as well as the other plant-based proteins and great stuff. That's why, and even to go into more depth, like the packaging, BPA, PFAS free, it's
Compostable.
compostable. So they really checked all of our boxes with like the B vitamins in here come from a fermented medium.
Third party tested.
Yeah,
nice.
made in the US. So we tried to
Formulated by healthcare practitioners.
we
Yeah.
try to check every box. And yes, you can go to Love Complement or marytout.com, or if you have the link down below. Yeah.
Yep.
Link your link.
Okay, yeah, we'll definitely include that in the show notes. So if someone is listening to this and they're like, okay, I have to join the Married to Health community, where's the best place for them to start?
Yeah, I mean, I would say the best place to start, marytout.com, joining our newsletter. I mean, we try to create a little bit of everything for everyone there, where it's like, I don't know yet. Okay, hop on our newsletter and just stay in the loop.
Read a blog.
Yeah, and learn more. We have freebies and resources on our shop page. You can register with our practice. So even if you go to start now, you can register, but there's no commitment. That means you're just kind of deeper in our practice. You can message some of our staff and dietitians with our HIPAA secure encrypted portal, and you can learn more about us. And
you can sign up for the waitlist for our SIBO IBS course. So if you're like, I'm curious about what you're saying, but I'm not ready to jump into one-on-one care or invest in that type of thing, but I want to learn more, we are relaunching our amazing plant-based, 100% plant-based SIBO IBS course. And we have been working on it for such a long time. We previously launched it in 2019. We had it running for several years, and then we knew we could do better. So we've been reworking on it for 2 years now. So you know that it's in depth. But if you're like, I want to learn more about FODMAP, or you said something about histamines or sulfur, I need a combination of those things. We have all of that and more. We're going to have incredible healthcare professionals in the course as well, educating like integrative gastroenterologists who specialize in SIBO, primary care providers who are plant-based, pelvic floor therapists, emotional release. So really all these things we talked about and so much more. So if you want to learn more about that, you can get on the wait list and be the first to know about when it opens up to the public.
Wonderful. Yeah. And we'll include as much as we can in the show notes below, so that for you listening or watching, you can just go and click and kind of figure out what it is that you feel like is best for you when it comes to joining the Married to Health community. Well, Dahlia and James, thank you so much for coming on the show. I appreciate you all. And I will have to close this down. Otherwise, I will keep asking you questions for forever. So thank you so much for your wisdom.
Thank you
for having us.
Thank you for all you do to spread information to people and for having us on. Well, we could talk forever too, so hopefully we'll have another conversation if people are interested in poop and farts more.
There we go. Sounds good. And thank you so much for listening today. We will catch you on the next episode.
Until next time, keep thriving.